There is a hidden truth that most seniors will never hear from their doctors. It's reality buried under layers of clinical protocols and insurance billing cycles. Every year, millions of seniors over the age of 70 line up for routine health checkups, thinking they are doing the responsible thing. They believe they are staying safe, catching problems early, and adding years to their lives. But what if I told you that some of those tests, the very ones your doctor says you need, could actually push you closer to a surgery you don't need, a stroke you could have avoided, or even a cancer diagnosis caused by the test itself? Recent medical literature reveals a terrifying statistic. Up to 37% of medical tests in seniors lead to unnecessary treatments, complications, or lifelong side effects. Shockingly, 99% of people over 70 have no idea they're being over-tested. We have entered an era of defensive medicine, where more is often mistaken for better. One of these checkups, the one sitting at number 1 on our list today, actually causes 5% of all cancer cases in the United States. To put that into perspective, that is roughly equal to the number of cancer cases caused by drinking alcohol every single day. You won't hear this in your local clinic's waiting room. You won't see it on a pharmaceutical billboard. But the truth is etched into the science, and today we are uncovering it all. In this video, we are breaking down the 5 health checkups you should avoid after 70 and the terrifying truth about what they can do to your aging body. Everything we discuss today is backed by real, peer-reviewed science, and you won't believe the common procedure that made it to number 2. Community engagement. Before we pull back the curtain, I want to hear from you. Let us know in the comments, where are you watching from? How old are you? And most importantly, have you or a loved one ever regretted a medical test or procedure? Do you feel that seniors today are tested too much? We read and reply to every single comment with personalized tips. Don't forget to like this video and subscribe. It helps us keep this independent health channel running. Now, without any further ado, let's talk about checkup number 5. It looks harmless, but it could quietly ruin your quality of life. Number 5 on our list is the bone density scan, officially known as a DEXA scan. On the surface, it sounds like a smart move. It's a quick scan, there are no painful needles, and you walk out with a score that tells you if your bones are at risk for fractures. But here's what no one tells you. Past the age of 70, a DEXA scan often creates more fear than it does actual benefit. As we age, our bones naturally lose some density. It's a physiological reality, just like getting gray hair or wrinkles on your skin. However, the DEXA scan is calibrated against the bone density of a healthy 30-year-old. When a 75-year-old woman is compared to a 30-year-old, the results almost always come back showing bone loss. This often leads to a diagnosis of osteopenia, a mild reduction in bone density that isn't even a disease. Yet, this number on a screen pushes millions of seniors into taking powerful medications called bisphosphonates, like Fosamax or alendronate. These drugs come with a dark side. They can cause jaw necrosis, a rare but horrific condition where the jawbone starts to die, and severe esophageal irritation. Furthermore, studies published in the Journal of the American Geriatric Society followed over 1,200 women over 70 and found that these drugs reduced fracture risk by only 0.3% over 5 years. The case of Rose. Consider Rose, a 76-year-old retired piano teacher. She was healthy, active, and had never fallen. Her doctor ordered a DEXA scan. It showed mild osteopenia, and she was put on meds. Within 3 months, she had such severe acid reflux and jaw pain she couldn't eat or play her piano. When she came to us, we took her off the meds and shifted her to vitamin D, resistance band exercises, and a diet rich in leafy greens and sardines. A year later, she was back at her piano, her balance was better than ever, and she had 0 fractures. For those over 70, unless you have a history of frequent falls, lifestyle interventions like strength training and proper nutrition reduce fracture risk by over 20%, according to a 2022 study in Osteoporosis International. Don't let a scan scare you into risky medication. Number 4 is the brain MRI for memory loss. When a senior feels a little more forgetful, perhaps misplacing keys or struggling for a name, the natural impulse is fear. We fear Alzheimer's. We fear losing our independence. Doctors often mirror this fear by ordering an MRI to see what's going on. But the uncomfortable truth is, MRIs show the structure of the brain, and in people over 70, that structure always shows age-related changes. You'll see slight shrinkage or white matter spots. In 97% of cases, these are totally normal and have nothing to do with dementia. A 2021 study in Neurology Today revealed 3,000 MRI scans in seniors with mild cognitive complaints. While 86% showed abnormalities, only 3% were actually linked to a treatable condition. The other 97% of patients were left with the crushing emotional weight of being told something is wrong with your brain when there actually wasn't. The story of George. George, a 74-year-old engineer, misplaced his keys and got an MRI. It showed white matter changes. He panicked. He stopped driving and withdrew from his community, convinced his mind was failing. But a simple paper-based cognitive test showed he was perfectly normal for his age. Once he focused on sleep and hydration, his memory returned. Unless there are severe symptoms like seizures or sudden personality changes, an MRI is usually a worry machine. A simple cognitive screening test is a much safer, cheaper, and more accurate first step. Number 3 is the cardiac stress test. This is often given to seniors who complain of mild fatigue or chest tightness. The test involves walking on a treadmill while hooked to a monitor or being given a drug that makes your heart race. It's meant to find blocked arteries. However, after 70, the false positive rate for this test is as high as 40%. That means the test says you have a heart problem when your heart is actually fine. This false alarm leads to invasive follow-up tests like angiograms, which lead to stents or even bypass surgery. A 2017 study in JAMA Cardiology found that more than half of stents placed after stress test referrals were done in patients who had no real symptoms or benefit to their survival. What they did experience were hospital-acquired infections, kidney injury from the contrast dyes, and bleeding. Raymond's warning. Raymond, a 75-year-old postman, felt tired on hills. A stress test led to a stent, but during the procedure, he had a reaction to the dye that caused kidney failure. He spent 6 days in the hospital and came out much weaker than he went in. His fatigue? It was just dehydration. If you aren't having chest pain during activity, a resting EKG or a coronary calcium scan is often a much safer way to assess your heart. Number 2 is one you probably didn't expect, the colonoscopy. While this is a lifesaver for younger adults, it is almost never recommended for those over 75, and it should be approached with extreme caution after 70. Why? Because the risks go up exponentially with age. The preparation alone, the strong laxatives, can cause severe dehydration and kidney issues in seniors. The sedation can cause long-term brain fog or cognitive decline. But the most dangerous risk is a bowel perforation, a tear in the colon. A 2019 study in JAMA Internal Medicine followed 1.3 million Medicare patients. For every 1,000 colonoscopies in those over 75, only 2 lives were saved, but 20 people experienced serious complications. That is a 10-to-1 risk-to-benefit ratio. Raymond's warning. Dana, a 73-year-old and healthy. Her doctor pushed for a screening colonoscopy despite her having 2 clean ones in the past. During the procedure, her bowel was perforated. She spent 9 days in the hospital, lost 10 pounds of muscle, and never fully regained her energy. For seniors, a non-invasive FIT test, a stool test you do at home, is often a much safer and just as effective way to screen for cancer without the risk of a hospital stay. Finally, we have reached the most dangerous, most overused checkup for seniors, the annual full-body CT scan. Often marketed as an executive health service or a total body wellness scan, these are framed as the ultimate way to catch cancer early, but the reality is a nightmare. A single full-body CT scan delivers between 10 to 20 millisieverts of radiation. To put that in perspective, that is roughly equal to 500 chest X-rays. According to a 2023 study in JAMA Internal Medicine, the massive rise in CT scans in the U.S. may be responsible for 5% of all cancers. You are literally being irradiated in a way that can cause the very disease you are trying to find. Furthermore, these scans find incidentalomas, tiny harmless cysts or nodules that are a natural part of an 80-year-old body. But once seen, they trigger a chain reaction: more scans, needle biopsies, and surgeries. Marcus, an 80-year-old martial arts teacher, felt great. A preventative full-body scan found a tiny 3-millimeter nodule. He was sent for a biopsy, which accidentally collapsed his lung. He spent months in recovery for a nodule that was completely benign and would have never harmed him. The American College of Radiology is clear: full-body scans for asymptomatic adults have no proven benefit. If you feel well, do not go hunting for trouble with a machine that emits that much radiation. Conclusion: modern medicine is a miracle, but it is not perfect. Sometimes less is more. Always ask your doctor, what happens if this test finds something? What is the risk of the follow-up? Real prevention isn't found in a tube or a scanner. It's found in staying active, eating well, and listening to your body. If you found this investigative report helpful, please share it with a friend over 70. It might just save them from a procedure they don't need. Check the description for all the study links, and I'll see you in the next video. Stay wise and stay healthy.